Ready? Okay. So my presentation's on congestive heart failure, and just to start off, does anybody in the class know what congestive heart failure is, or has any type of idea? Negative? All right. When you have congestive heart failure, does anybody think that your heart actually stops?
It doesn't.
Everybody agree with that? Okay. So when you have congestive heart failure, it's actually not a failure of the heart. It is when your left ventricle struggles to pump blood out to your body, so you don't get enough oxygen and nutrients to the rest of your body parts. You will actually live if you have congestive heart failure, just possibly not for a great amount of time. So when the pumping power of your heart is weak, the body doesn't receive all of the nutrients that it's supposed to get. And when this happens, the blood is not efficiently circulated through the circulatory system and starts to back up, increasing the pressure of the blood vessels in your body. And it forces fluid from the blood vessels out into other body parts. So congestive heart failure is actually when the fluid backs up and begins to swell your limbs. Like your feet will swell, your ankles, even sometimes they said that your eyes will swell, your lungs will swell, your lungs will get congested, all right? And the reason of everything being congested is why they call the condition congestive heart failure. All right, so when the left side of the heart fails, your lower limbs start to swell up. So your feet will swell, your ankles will swell, your legs will swell. When the right side of your heart starts to fail, your abdomen swells and When your left side swells, you get congestion in your lungs. When your right side swells, you get congestion in your limbs, in your abdomen, all right? And if you can get this condition over several years, or it can automatically happen, let's say from a heart attack. I forgot to go through this, you guys. All right, so I just have a picture here in the corner. The left side is a picture of the congested heart. The right side is the normal heart. Okay, so you've got two types of heart failure. You have a systolic heart failure and a diastolic heart failure. Systolic heart failure is also known as systolic dysfunction, and it's when the heart muscles don't contract with enough force to get the blood out to the body. When you have this, you have an ejection fraction that's below 55. A typical ejection fraction is 55. Do we all remember what an ejection fraction is in the class? No?
Yeah,
okay.
so the question, what's the equation to calculate EF?
Stroke volume. Yeah. So cardiac output divided by something.
All right. So the equation for it, close, is when how much blood is being ejected out of the heart. It's how much blood is being ejected out of the heart on the left ventricle divided by the maximum volume remaining in the left ventricle. And at the end of the diastole, it should be greater than 55%. Does that make a little bit of sense to you guys? Yeah. Okay. The second type is diastolic dysfunction. This is also known as diastolic heart failure, and it's when the heart contracts normally, but the ventricles don't relax properly, and less blood enters the heart and during normal filling. So it'll still pump, ventricles are okay, but it's just not strong enough. With this one, the heart is unable to fill with blood, and it prolongs back up into the lungs, and that's what begins to produce some symptoms. All right? Diastolic failure is also more common in patients that are over 75 years, and they're also more common in women. With this one, your ejection fraction will be increased or it'll be the same. So you won't necessarily notice a difference with it. All right, there's 4 stages with congestive heart failure. You've got stage A, stage B, stage C, and stage D. Stage A, you are at high risk for developing congestive heart failure. So you don't necessarily have it yet, but you're kind of on the way. You've got at least one symptom, if not more. Symptom stage B is asymptomatic, so you don't quite have any symptoms yet, but you have several of the risk factors. Like you have a couple of the risk factors. Stage C is symptomatic, so you begin to form symptoms, and I'll go over the symptoms in a minute, and it'll clear up a little bit. And stage D is when the patient has heart failure symptoms. They're diagnosed with heart failure, and cardiac transplantation or other means of fixing it are completely necessary, or it'll lead to death. All right. the New York American Heart Association has also broken up congestive heart failure into 4 different categories. You've got class 1, class 2, class 3, and class 4. And these classes explain your exercise limitations and what you can and cannot do. So with class 1, you have absolutely no physical limitations because you don't have any symptoms. Class 2, you have a little bit of limited exercise allowance because you kind of have a couple of symptoms when you start to do physical activity. Stage 3, you have a good amount of limitations because you've got symptoms when you're exercising and you also have symptoms when you're not exercising. In stage 4, you have severe limitations. So you can barely do anything besides, walk to where you gotta go to, nothing extra, no gym, no cardio, no treadmill exercises that we do in class. Because once again, you have symptoms all the time and you have symptoms at rest. All right, so now we're gonna go through a couple of causes of congestive heart failure. You have cardiomyopathy. Do you remember what that is? Yes, no? No? All right. So cardiomyopathy is weakening of the heart muscles. You can also have damaged heart valves, which will cause congestive heart failure. Toxic exposures, so cigarette smoking, alcoholics, and people that do other drugs, coke, all the extra stuff, are more likely to get congestive heart failure than people that don't do any of those. Infections that affect the heart can also cause congestive heart failure, and some genetic diseases, once again, will cause it. Prolonged serious arrhythmias that you don't take care of and you don't check up on, eventually down the line, you'll get CHF, congestive heart failure, just so I don't keep repeating that word over and over. And conditions that overwork the heart, so diabetes, thyroid disease, kidney disease, high blood pressure, low blood pressure, all some causes. Also, if you have a high salt intake, you're more likely to get it. Blocked vessels that supply the heart, it could lead to heart attack, and like I said earlier, heart attack is a major cause of congestive heart failure. Coronary artery diseases, diseases of the arteries that supply blood and oxygen to the heart, causing decreased blood flow will cause it. And there are many other less common causes that some people will have. Okay, so now we have some symptoms. Oftentimes, patients don't always have symptoms. Or if they do have the symptoms, it's not necessarily symptoms that are going to make you think that it's an issue with your heart. So one of the symptoms is shortness of breath. So when you're exercising, exercise that you were once able to do, you're not going to struggle with. So you may have been able to run a mile. Now when you get to a quarter of a mile, you're shortness of breath. You can't breathe, you don't know what's going on. Oftentimes when you're done exercising, you sit down, relax, your breath will come back and you'll be okay. Then you can also have shortness of breath while you're sleeping or while you're sitting in the house not doing anything. Oftentimes they say that the shortness of breath while you're sleeping will wake you up out of your sleep actually, and you'll feel like you can't breathe. Kind of like you were exercising, but you weren't because you're in your bed. This will also go away if you just relax for a couple of minutes, everything will calm down. I have a picture over here of somebody pushing into somebody's legs. This is called pitting edema. And pitting edema is when the person has swelling in the limbs, and if you push on it for a couple seconds, you let go, your fingerprint will still stay there for a couple of minutes. So that, could be a little bit uncomfortable. Another symptom is cough, which also if you have a really bad cough, you're not automatically going to think, I have a heart issue, let's go get my heart checked out. You're just going to think you have a cough. Also, when a person that has a known breathing disorder like COPD, asthma, bronchitis, when their symptoms begin to get worse for no apparent reason. So let's say an older man has asthma, and usually he only has an asthma attack when it's cold outside, when he's walking to and from his car. All of a sudden now he can be inside or go outside for a short amount of time and his symptoms are going to get increased. He'll have to use his inhaler more often. It just won't be so comfortable for him. All right, fluid retention in the body are also symptoms. Fluid retention is going to cause your swelling. Example of swelling is pitting edema. And congested lungs. So you can also have a wet cough, so it sounds like you've got, anybody in the class ever had pneumonia? When you have pneumonia, you cough and you're coughing up phlegm, and there's just fluid all in there. It's kind of similar to that, where you've got the fluid in your lungs, and you can also hack up phlegm, and so that's one of the symptoms. Once again, that's not something that you're automatically going to think, this is my heart, let's get something done. All right? Okay, so a risk factor. Physical inactivity. If you don't do anything, you're more likely to get this disease. Hypertension, diabetes, obesity, which is a factor of inactivity. Smoking, metabolic syndrome is a risk factor. Excessive alcohol consumption, high cholesterol. Race is a big factor in this. African Americans are more likely to get congestive heart failure than any other race. And age. The older you are, the more likely you are to get this disease as well. I found some statistics that said 1% of people age 50 plus have congestive heart failure. 5% of people age 75 and up have congestive heart failure. And 25% of people that are 75 and older have congestive heart failure. So as you can see, the older you are, the more likely you are to get congestive heart failure. Also, surprisingly, certain exposures to chemicals like radiation, chemotherapy can also be a risk factor for congestive heart failure. So there's several ways you can diagnose this. One way is a blood test, and as we know, the blood test will evaluate the kidneys, thyroid function, and checks your cholesterol levels. It also looks for anemia, because anemia quite often presents similar symptoms, but doesn't necessarily mean that you have congestive heart failure. So they'll run the blood test to make sure that you're anemic and you're not actually having heart issues. You can also take a chest x-ray, and the chest x-ray is going to show you the heart. It'll show you the size of the heart. If you have congestive heart failure, they say that your heart is typically a little bit bigger, and you'll be able to actually see it in the x-ray. It'll also show that if there's fluid buildup in the body, around the heart. There's also an echocardiogram, which is an ultrasound that shows the heart's movement. I have a picture up here. This is actually a picture of an echocardiogram of the heart, and it shows you the different valves. And the echocardiogram provides information on the left ventricle. That's mainly what they're going to look at when they look at this. As we know, we have an ECG. We've run them many times in class. That will give you all the information that you need on a heart. It may not necessarily show that the heart is bigger. Definitely won't show that the heart is bigger, because you can't actually see the heart using it. But it'll give you a good amount of information off of the ECG. You also have cardiac catheterization. Dr. Nanavati spoke about it earlier in the semester. This is an invasive procedure, and what they'll do is that they will take a catheter, stick it, I think they said they'll go in through a leg or an arm or in the stomach, and it'll put the tube up to the heart, and they'll insert a balloon, and they'll inflate the balloon to help with the swelling and prevention. And it measures the pressures inside of the heart. We have an MRI. Many of us know an MRI, right? We've kind of had them done, some of us. The MRI is also known as a magnetic resonance imaging. It provides information on the structure of the heart, and an MRI contrast can actually show the inflammation within the heart. It'll also show if there's any injuries within the heart and any blood flow challenges within the heart. Okay, so we've got treatment. The first treatment, lifestyle change. We've learned that that's kind of the way to help fix a lot of the issues that we have. If you are sedentary and you begin to have congestive heart failure, you have to get up and you have to proceed to do some exercises. Walking to the store, walking anywhere is better than doing nothing. If you have excess fluid buildup from the body, so if your limbs are swollen, they say to elevate those limbs when they are swollen. You also want to take your weight in the morning if you wake up and you're not swollen, and then take your weight at the end of the day, and you want to document it and show it to your doctor and let them know that the weight changes that you're going through throughout the day. Also, if life changes do not occur, you're more likely to have a worse case of congestive heart failure, which will ultimately lead to death. And also with lifestyle changes, they want you to focus on your emotional stress. They want you to try not to be stressed and kind of relax a little bit, because that will also put some more pressure on the heart. We also have medications. You have several different medications that you can take. You can take your diuretics, vasodilators, and beta blockers. Diuretics are water pills, and they cause kidneys to remove excess water out of the body. When you are on diuretics, you have to monitor your potassium levels, because oftentimes the diuretics will move the potassium levels. They'll increase it, or they can decrease the levels to numbers that you don't really want it at. You have vasodilators, which enlarge small arteries to relieve systolic workload of the left ventricle. So it will help relieve some of the workload on the heart. From vasodilators, you have ACE inhibitors, which block angiotensin II from the body. Angiotensin causes vasoconstriction and increased workload, which, as we have discovered, not good for the left ventricle. You want to minimize workload on the left ventricle. And ACE inhibitors also prolong life by slowing the progression of the heart damage. Then we have the beta blockers. Beta blockers slow down heart rate, blood pressure, and they help lessen the workload of the heart. And then aside from the medications, there are several different medical treatments that you can get done. You can have an angioplasty, which is an alternative to bypass surgery. For those that have congestive heart failure caused by coronary artery disease, a stent is put into the heart and pushes aside the cholesterol deposits. And the cholesterol deposits, as we learned, block the arteries, so it helps that out. Then you can also install a pacemaker. Everybody know what a pacemaker is? All right, so it's a little device that is entered into the body right above the heart. So a lot of people that have pacemakers, you can actually see it protrude from their chest. And this will control the heartbeat from slowing. If it gets too slow, it'll pick the speed back up. We have implantable cardioverter defibrillator, which I've learned is kind of similar to a pacemaker, but it's a little bit more intense than a pacemaker. It returns the heart to normal rhythm if your heart slows down too much or if your heart speeds up too much. It'll send an electrical shock to the body, kind of like an AED that's already in your body that other people don't have to work on with you. And you only put this in patients that have physical limitations. So the people that were in class 2 or class 3 of exercise limitations will typically have this. All right. You have cardio resynchronization therapy, and this is used to synchronize the pumping action of the left ventricle and the right ventricle to get them on the same pace. Synchronization improves the effectiveness of the heart as a pump. So if one side is pumping too fast and the other side is pumping too slow, we all know that can cause some damage to the body. You also have coronary artery bypass graft, and this is for severe cases. So people that can't do any exercise, have this case prolonged for a large amount of time, have the coronary artery bypass surgery. This ensures that the heart maintains blood supply to the body. You also have the valve replacement surgery. This surgery repairs malfunctioning heart valves. You have the LVAD, which is left ventricular assisting device, and it's surgically implanted into the body and is used until the person can get a transplant. So it's not a fix, it's kind of a Band-Aid over the patient until you can take it to further measures. And then you also have a total heart transplant. So this is for patients that aren't too old, maybe in their 40s, 50s, possibly even 60s, depending on their lifestyle, that will have the total heart transplant. And then we have exercise with CHF. So exercise is going to be more for the patients that are in class 1 and class 2. Class 3 and 4 typically have a lot of limitations on their exercise. So before you exercise, as you want to do with any type of issues you have with your body, you want to talk to your doctor first. You want to find out if there's anything that you can't do, anything that you shouldn't do, and anything that you should stay away of, what'll be good for you to do. All right, so when you exercise with CHF, You want to focus on your flexibility. You want to do a little bit of aerobic exercises, some strength training, and that's about it. Nothing too fancy, just keep it to the basics. The exercise will strengthen the heart and your cardiovascular system, which is the goal of everything. It will also improve your heart symptoms. So if you have shortness of breath when you're exercise, if you begin to exercise more, your shortness of breath will go away. You'll be able to exercise for a longer amount of time, and you'll ultimately maybe be able to get back to where you were in the first place. All right? And as we all know, exercising increases your energy levels. If you exercise daily, you always get like a little bit of boost of energy. When you exercise with CHF, you want to avoid exercising outdoors during extreme weather. So in the 20-degree weather, don't go outside. 90-degree weather, don't exercise outside, and when it's too humid. We've all exercised in those extreme weathers. I know you run track, right? So I know you ran outside when the cold. And as a healthy person, when you run out in the cold, you can tell that you already struggle to breathe a little bit. So imagine doing that when your body isn't working to its full capabilities. It puts too much strain on the body. All right? And you want to stop exercising if you have chest pain, if you get dizzy, if you get nauseous, if you get a shortness of breath that's too much where you feel like you could possibly pass out from it. If you have a heart rate monitor on, you want to stop exercising if your heart rate skyrockets. If you have somebody in the gym or where you're at that has a blood pressure cuff and stethoscope, when you're done exercising, when you think you're almost done exercising but you want to continue, have somebody check your heart rate and they'll let you know whether or not you can continue. If you have pressure in your chest, arm, or neck, you want to stop exercising. And if you begin to swell more than you typically do, you want to stop exercising. Okay, so some statistics are that CHF affects nearly 6 million Americans, which is 2% of the adult population. 670,000 people are diagnosed with this condition a year. Doesn't sound too much, but it's a large amount of people. The rate of death is 10% after 1 year, and about one half of those diagnosed with CHF will die within 5 years of their diagnosis. So if you get diagnosed, let's say you get diagnosed when you are 75, you have a 50% chance of dying by the time you're 80. So there's not a very long life expectancy with CHF. And 1 in every 5 people will be diagnosed with this in their lifetime. Okay, so I read a research article that compiled a bunch of different information that was done on CHF and exercise. The purpose of the study is to review the physiological adaptations that will result from training. They studied 2,331 participants in the study. The middle age for the study was about 59 years old. Women was 33% of the study, and 63% of the study were in Class 2 and Class 3 of the New York Heart Association's exercise limitations. They discovered that during exercise, your VO2 will increase within the first 3 months of exercising. After the 3 months, it doesn't raise much higher than that. That's about as best as you're going to get with your condition. Training above the anaerobic threshold can result in temporarily decreased size of the left ventricular systolic function. So it'll help your left side of the heart function a little bit better. Also, they discovered that regular exercise seemed to induce a mild reverse remodeling effect of the heart, of the left ventricle. So if the ventricle is enlarged, when you exercise, it will shrink it a little bit. But if you stop exercising, there's a chance that it'll go back to the original size that it was originally at. Okay, so they also did a study that was over 12 weeks of higher aerobic training. And they took 2 groups, one that exercised, one that didn't exercise, and compare them. And they showed that there was an 18% reduction in left ventricular and diastolic volume. So the diastolic volume decreased in the participants that did the exercise program. All right? And they also studied the safety of exercising with CHF, and they did come to a conclusion that it is safe within certain reasons. Several trials showed that it is safe in patients that have a stable heart, that have had stable heart failures, and only 3% of the patients in the exercise groups had cardiac events while they were training. Okay. So the second article that I did was a similar study. It was one study though where they had people exercise for 14 months, and then they had a control group that did no exercise. They were all of the same conditions, except they just split it up like that. They wanted to see if exercise had an effect on the quality of life, and if it had any necessarily health benefits. Okay, so they had 99 patients that were broken down into 2 separate groups, and at the beginning of the study, they had them fill out some questionnaires. They did a couple of tests on them, and one of the questionnaires that they filled out was their quality of life, of Minnesota scale. Actually, I'll pick that up. The study spanned over 14 months. They did an initial intake. After 2 weeks, they looked at the patients again. Then they looked at them after 14 months, and then they kept in contact with them after the exercise. So it was a very long process, probably about 2 years the study lasted at least. They came to the study that for both groups, there were no changes in the diameter of the left ventricle. Out of 99 patients that were in the study, 58% of them had a cardiac event. 13 of the cardiac events were during the study, and 13 were done during the study, and 41 of the events happened after the study ended. So during the follow-up period, 41 people had a cardiac event. After looking at everything, they realized that it was more frequent in the participants that did not do the exercise. So in the controlled group, you were more likely to have a cardiac event after the study ended. Okay? And during the training, there were 8 events. 8 events in the training group and 17 events in the controlled group. So there was almost a double amount of events in the controlled group that did no exercise. Now, throughout this whole study, there were 29 deaths. There were 9 in the exercise group and 20 in the control group. So that's more than double of the amount of deaths in the controlled group than in the exercise group. The first 2 months of the study, there was 1 event in the exercise group and 3 events in the controlled group. And then within the 12 months of the study, there were 3 events in the exercise group and 6 events in the control group. Once again, everything is kind of doubled over. You're twice as likely to have an incident if you're not exercising than if you were exercising. All 25 of the non-fatal events were hospitalized, and after looking at all of the patients, they did come to a conclusion. Once again, if you didn't exercise, you were more likely to end up in the hospital repetitively. So maybe not once, you were more likely to go in twice or 3 times. And the mortality was lower in the exercise group. Also, the improvement of peak VO2 showed after 2 months, and like the previous study that was done before, after 2 months, after 2 to 3 months, there was no increase. So we've learned that with this study, exercise is going to play a gigantic part on how you cope with CHF. If you don't exercise, you're more likely to have more cardiac events, you're more likely to end up in the hospital, you're even more likely to die. So exercise, you guys. And here's my references.